Medicare open enrollment. What do you need to know? Well, today we've got a person who is an expert in Medicare, Sean Southard. He's going to walk you through 5 reasons why you need to meet with a Medicare person in open enrollment. So make sure you listen all the way through.
To learn more about how to secure your retirement and all the different elements you need to know, please subscribe to our channel and hit the bell so you'll be notified when we release episodes every Monday. We have helped hundreds of our clients gain clarity and get on the path to a great retirement. Now it's your turn. Let's dive in.
Welcome to Secure Your Retirement Podcast. Today we're talking Medicare. And there's no way that Merce and I could talk Medicare by ourselves as good as anywhere close to as we could if we didn't have our specialist with us, Sean Southard. So, Sean, thank you for coming on and helping us with this complicated topic of Medicare. We appreciate it very much.
Yeah, same here. Hey, guys, it's great to be here. Thanks.
Excellent. So, Medicare every year has this time in which people are able to do open enrollment. So could you just real quickly, Sean, before we get in, because the real theme here is 5 reasons why you should meet with a Medicare agent during open enrollment. Could you just give us a real quick overview of what open enrollment means?
Sure. Every year, Medicare has a window of 8 weeks. It starts on October 15th and runs through December 7th, the same dates every year. And it's a time period in which all Medicare beneficiaries, everybody who's enrolled in Medicare, can make changes to their Medicare structures if they need to or if they want to. So it's a very big time, obviously, for Medicare beneficiaries, and it's going to be a very critical time for many people if they do need to make changes.
Yeah, so we are in that enrollment period right now, and hence the reason for this entire podcast is, well, we're in it. You may be on Medicare, you may be turning 65 this year, but as we are in Medicare open enrollment, there's things that Sean thinks, and I would think most Medicare agents would think you need to check on and review. So we've got 5 we're going to walk through here. The first being review your current coverage. So Sean, tell us why that's important and why that needs to be done every year, even if you're already on a plan.
Sure. Well, every year, the Medicare, the carriers, the insurance companies that work with Medicare to create Medicare Advantage plans and prescription drug plans known as Part D, standalone Part D plans, are allowed to and do change their plans for a number of reasons. So even though you're in a plan and it may have been in the plan with the same company for a couple of years, you may notice that it changed. There's some aspects of it that has changed from this year going into next year. And same with the Part D drug plans. So they don't necessarily always stay the same from year to year. So it is important that you do look at that. Now, the plans are required on the Medicare Advantage plans. They are required to send out what's known as an annual notice of change, known as ANOC for short. Medicare loves acronyms, so ANOC. And that is a comparison tool that will allow you, if your plan has changes, to look side by side. This is what the plan offered this current year, and this is what it's going to be doing for next year, so you can look at it side by side and go right down through all the changes. So it's very important that you, when you get that document, that you actually look at it and don't throw it away. And of course, when you're going to be meeting with your agent, that you should bring that with you so they can also see it. So bottom line is, what worked for you last year may not be the best fit or may not work for you in the upcoming year. So you definitely should review your coverages.
Excellent. So now, obviously, we know with Medicare, there are different things that we have to, buy or pay for sometimes. And so when it comes to this idea of what this is costing me, why would this be an issue that we'd want to consider?
Sure. So another, reason to meet with an agent during this time period is you should definitely evaluate your costs that are going to be impacting you for the upcoming year, especially for Medicare Advantage folks that are enrolled in those plans. Sometimes from year to year, you'll see the plans will have premiums. Maybe the plan that you're in right now has a zero premium, and then for next year, your plan changed. They're going to be charging $15 a month or $40 a month. Okay, so now it's no longer going to be free if you stay in that plan. So it's important that you look at all the plans that are going to be available to you and look at what those premiums are going to be for the upcoming year. A lot of times co-payments amounts change and co-insurance amounts change. So some years you may have a zero copay for certain things, or you may have a $25 copay to go see a primary care physician, and then next year they're going to charge $35 to go see a primary care physician. So your cost to go see the doctor went up $10 per visit. Or co-insurance has changed. They may have went from a flat rate, maybe for a surgery, it was going to cost $600 for you to pay, and then all of a sudden now they're going to 10% or 15% of the cost of the surgery that you're going to be responsible for. And then maximum out of pockets change. In 2025, the maximum out of pocket is going to be right around $9,400. Medicare Advantage carriers are going to be allowed to, if they want to, have a maximum out-of-pocket limit of $9,400 in their plans. So you definitely need to be looking out for that. I do find over the years that that's one thing that many Medicare beneficiaries on Med Advantage plans overlook, is the maximum out-of-pocket they would be responsible for. So definitely very critical to look at those cost components within your plans. And then for the Part D, real quickly, with all the changes that are coming in 2025, premiums are going up. So that's something to definitely look at this year if you are enrolled in a Part D standalone plan.
Yeah, and so cost is always a big factor in a lot of people's Medicare selection process and decision-making process. But what is important with cost is what types of value you're getting for that. And a lot of these plans have things outside of just medical. So can you talk a little bit about some of the things someone may need to evaluate outside of medical during this annual enrollment period as well?
Absolutely. So a lot of these Medicare Advantage plans, if you are in those and those that are in them know what I'm talking about. Original Medicare does not offer some things that we feel that they should and that we were used to all of our lives until we got into Medicare, such as preventive dental, getting your teeth cleaned, and that once a year x-ray that they do for your mouth and your gums, going to get our vision checked, right, our eyes examined and so forth, and help with contacts and frames and lenses, and then hearing exams and so forth. So a lot of Medicare Advantage plans do offer those services inside their plans, but from year to year that can change. They may offer vision, and then the next year they're not going to offer vision, for example. And that is happening this year, where some plans are scaling back and taking away some of those extra benefits, as they say. So if you're not paying attention, you're not reviewing, and you're not getting together with an agent to go over that, you may find out the hard way to come next year in January, that service that you're used to having is gone. So it's important that you review that and make sure it's still going to be in there if that's important to you. And of course, fitness programs, a lot of them offer United Healthcare's is called Renew Active. They have a very robust gym network out there that people can utilize. There's Silver Sneakers, where you can go to different gyms and participate in those Silver Sneaker workout programs and so forth. So it's important to know that are they still going to be there? Still going to be part of your plan, or you may have to switch over to somebody else to keep those benefits. And for those that are on Medigap plans, I don't mean to leave you out there, because I do know that there's plenty of folks that are listening to this that are on med supplements or Medigap plans. Do know that many carriers that offer Medigap coverage also offer, as part of it, they're not really allowed to talk about it up front until you get into the Medigap plan, but they do have discounts. They don't actually have the plan itself, like they don't have a vision plan, but they have discounts. They have many vendors that they participate with to give you discounts on dental and vision and hearing exams and hearing aids and so forth. And they do have gym membership networks as well. So it's important to make sure you're assessing that and making sure that those are still going to be there for you in the ways that you want them and need them in the new year.
Excellent. So now, why should we do this next point that we're going to discuss here? Point number 4, check provider networks.
Yeah, so checking provider networks is very critical to the whole process, especially for those on Medicare Advantage plans. Those on Medigap plans or Med Supplement plans, their health insurance comes from Original Medicare. And Original Medicare's Part A and B, hospital and medical coverage, there are no networks in Original Medicare. Original Medicare is not an HMO or PPO plan. They just need to be concerned about, does the doctor or provider take Medicare? Does the hospital take Medicare? Unfortunately, over 99% of providers and hospitals in the United States do take Medicare. So that's all they need to be concerned about. Those on Medicare Advantage plans, on the other hand, are in these private plans that work in conjunction with Medicare. But a lot of people don't realize that when they enroll in those plans, Medicare Advantage, their health care is coming from that specific plan, not from Original Medicare. So in that way, they need to make sure that next year, the providers that they use and the providers that they need to see, are they going to be accepting that plan? Because Medicare Advantage plans are network plans. They are HMOs. They are PPOs. They are HMO POSs, point of service plans. So not all providers take the plans, okay? And then providers can come in and out of those networks. So it's important that you're reviewing that. And especially if you have something coming up where you're going to need to have a procedure or a surgery performed, you definitely need to make sure that they're going to be in the network and they're still taking your plan.
Yeah, and then for our final one on this list, I know we've done a previous podcast with you, Sean, around the changes coming to Medicare and some of the changes in the drug coverage. So number 5 here on our list is review prescription drug coverage. Let's talk about why that's so important right now.
Yeah, this is a burning topic. I've been meeting with people last week, meeting with lots more people this coming week, and the remaining 6 weeks of this annual enrollment period for Medicare. The biggest change, well, there's 2 changes really. The 2 biggest changes, one on the front end, one on the back end, with prescription drug plans for Medicare. First of all, the maximum out of pocket has dropped from $8,000 down to $2,000. So once a person in 2025 has come out of pocket for $2,000 for their prescription drugs, they're going to be in catastrophic coverage, which means that they'll pay $0 for their prescription drugs for the remainder of the calendar year. This year and previous years, it was $8,000. So that's going to be wonderful for so many Medicare beneficiaries out there that are on prescription drugs, especially brand name drugs that don't have generics right now. However, on the back end, the change that's really impacting everything is the way it's been written into law is that now drug plan providers, the actual companies that provide drug plans, prescription drug plans for Medicare beneficiaries, are going to have to pay 60% of the cost of the drugs when people are in catastrophic. Right now, they only pay 20%. They're going to have to pay 60%. So these companies are, because obviously they're very smart. They have actuaries and figure all this out. And they said, hey, in order to get the profitability that we want and that we need, we're going to have to take in more premium on the front end to offset these back end costs that we're going to be paying for all these beneficiaries in catastrophic coverage. So what we're noticing is that a lot of the drug plans premiums have shot up. So anywhere from 10% to 17, in a couple of cases, I've seen about a 22 to 24% premium increase from last year to this coming year. So that is something to definitely be aware of and be reviewing. Even with the change, though, ironically, the plan that you are in right now may still be the best plan for next year. But it's important that you take the time to review it for sure. And then, of course, the formularies have changed a little bit. Formularies are the drug menu, what drugs are covered and how they're covered and what tier they're on, the different tiering systems, those have changed a little bit. So depending upon what drugs you take, you may notice next year that you're paying more copays. So your drug may have gone up a tier or two from the previous year. So it's important that we're reviewing these drug plans and that you're taking the time to make sure that what you have is going to be the best for 2025.
Excellent. Well, Sean, as always, you always give us what we need to understand and make it super easy to understand when it comes to something that it can be complicated. So could you just take a moment and let people know if they wanted to have a review and meet with someone, and particularly you, how that would work, and then also how they can reach out to you?
Absolutely. So my motto is always keep it simple, KISS. My grandfather always told me, keep it simple, Sean. So always trying to keep it simple. So a meeting with me, just a couple of things. It would bring you some personalized service. I've noticed for many people that I've worked with so far, they don't even remember who helped them get into Medicare and everything. It's been a while. So that's telling me that those people that they first work with aren't keeping in touch with them, and they've lost connections. So luckily, I haven't seen any cases where people they're not in a bad situation. They're actually in good situations. So at least those initial people have directed them in the right way, which is good. But with me, you're going to get that personalized service. I follow up and keep in touch with my clients and the people that I work with. And of course, there's no cost to meet with me. It doesn't cost you any money. I don't charge any fees. And if you were to do these things on your own or go to carriers direct, it's the same. The premiums are different. Everything is the same. You're coming through me, except you get that personalized service working with me. And the best way to reach me, you can obviously go to our website here for Peace of Mind Wealth Management. You can call the office at 919-787-8866, or you can email me at my email address. It's Shawn with a W, SHAWN at pomwealth.net. And I will definitely get in touch with you as soon as I can and get you scheduled to come in and see me.
All right. Excellent. Thank you very much, Sean. We appreciate it.
Thank you, guys. Always a pleasure.
And just so everyone's clear, it's pomwealth.net, and you can reach him here at the office, as he said. We hope this has been beneficial. We'll talk to you again next week.
We hope this video has given you some confidence and clarity as you plan for a worry-free life in retirement. But what else do you need? We have created a complimentary video course called 3 Keys to Secure Your Retirement. This video walks you through step-by-step what you need to do to get ready for retirement. You can also check out our podcast called Secure Your Retirement. You can subscribe below.
For more retirement tips, check out these videos. Also, if you find them valuable, please subscribe to our YouTube channel and give us a like.